Hello, I am going to demonstrate the beautifully constructed and designed foot and ankle instrument set for the soft tissue reconstruction, that of Biotek. So if I open the lid, I see a tray which has got multiple drilling instruments which would help for the soft tissue reconstruction in foot and ankle. So these two are the protection sleeves. Whenever you are passing a wire, whenever you are passing a drill bit, you need to protect the soft tissue. These are various protection sleeves of the different sizes, and then you have a drill bit of various sizes starting from 4 mm onwards. So these drill bits would be useful when you want to transfer or attach the tendon to the bone. It would be as per the size of the tendon you're going to drill, and then you're going to pass your interference screw. For sizing the tendon, you have this small but a very important instrument into which you pass the tendon, and you can learn the diameter of the tendon, whether it is 4 mm, 5 mm, 6 mm. This is very, very important in foot and ankle. As per the diameter of the transferred tendon, you're going to drill, and then you're going to replace it with the interference screw. There are two small drill bits. These drill bits are essentially meant for pushing anchor into the small bones of foot and ankle joint. Till the time this set came in, till the time the implants from Biotek came in India, we were really suffering a lot to push in small anchors into small foot and ankle bones, into small joints. So these two drill bits would help you to drill out into the proximal phalanx, into the neck of the metatarsal, into the middle phalanx, distal phalanx, and after drilling it you can push in your small anchor. So small anchor of every possible size are available in Biotek implant armamentarium. Coming to the bit pins, the bit pins are devised in some different manner. So these two are a bit pin which are uniquely devised to push in button fix syndesmotic fixation assembly. This one has got a fluted tip which can be drilled directly, and at the back of it you have an eyelet through which you can pass your syndesmotic device. Again, this is a drill bit, and on the back side of it you have an eyelet through which you can pass your syndesmotic device. So that's for syndesmotic fixation. You also have different size guide wires over which you pass this drill bit, and there is a separate drill bit for putting your syndesmotic device. So that is with respect to the upper tray. When I lift the upper tray and when I see down onto this lower tray, now this is a typically devised lasso assembly for plantar plate repair. When you want to pass sutures through the plantar plate, it's a very small narrow space into which you want to grip your plantar plate with the suture. This is a needle which passes and catches the plantar plate, and then you can push in a nitrilon wire which goes through the device and which comes out, into which you can thread the suture and pull the suture. So this is typically used for plantar plate repair. The another curved lasso which is there in the set is meant for minimally invasive tendo-Achilles repair. So you pass this lasso through the distal portion of tendo-Achilles, and through which again you thread a nitrilon wire, pull out the sutures from proximal end to the distal end, and you can tie the sutures solidly over the calcaneus with Wimp fix anchor. There are three different sizes of screwdrivers which are meant for interference screws of various sizes. The problem with the Indian foot and ankle is whenever you want to anchor a tenodesis screw into the bones of a female patient or an adolescent, you don't have these sizes available. The Western sizes which are there with us starts from 7, 8, sometimes 6. But we need tenodesis screw of 4 mm, 5 mm for our smaller bones, for osteoporotic bones, for female patients. These are the screwdrivers for small sized tenodesis interference screws. And then you have a tap through which you tap this swim fix anchor. So whenever you pass a wire, drill it with a drill bit, you need to tap the hole, may it be in the sustentaculum tali, may it be into the medial malleolus, may it be into the talus. You need to tap it, and then you are putting your 4.75 Wim fix. And this is another beautiful instrument which is like an owl, small owl, which makes a hole for you to push in the suture anchor into it. I think this in all completes the introduction of this comprehensive set. You need to do deltoid reconstruction. If you require to do lateral ligament reconstruction, you want to transfer FDL to the navicular, you want to do spring ligament reconstruction, you want to do minimally invasive tendo-Achilles surgery, you want to do cross bridge fixation of insertion of tendo-Achilles, these instruments are comprehensively available to you. You can do any and every soft tissue procedure. You can do any and every soft tissue procedure which requires tendon to be passed through the bone, tendon to be anchored to the bone. This would be very, very handy.